Wrist pain can sneak up on anyone, but for massage therapists, it's especially dangerous. I'm Dr. Ben Benjamin, and in today's video, I'm going to break down the 6 most important things you need to know about wrist injuries: what causes them, how to assess them, what treatment works, and how to keep them from coming back. Let's get started. 1. The prevalence of injuries. Wrist injuries are surprisingly common and affect people who use their hands a lot. And this includes carpenters, musicians, construction workers, computer users, and of course, massage therapists. You know you have an injury when it's particularly painful to fully extend or to flex your wrist. Now, even simple movements like pushing yourself up from sitting on the floor, using a hammer, or typing hurts. 2. The anatomy of the injury. So what causes that pain and limits your movement? There are 8 small bones in the wrist, and all are attached by a series of small ligaments. Sometimes the small bones of the wrist become misaligned, adding additional stress on these small ligaments that hold your bones together. A separate series of ligaments holds the wrist to the forearm. The ones most commonly injured are called the collateral ligaments. There's a radial collateral ligament on the thumb side of the wrist and the ulnar collateral ligament on the pinky side. Less common is injury to the palmar and the dorsal ligaments of the wrist. When any of these ligaments are sprained, scar tissue is formed and your brain is signaled to produce synovial fluid into the joint, which is what makes the wrist joint swell and limits your movement. Your body is saying, don't do these movements or I'm going to hurt you. The longer the injury persists, the more entrenched the pain-producing adhesive scar tissue becomes. And long-term injuries require much more treatment. 3. The causes of injury. One major cause of wrist injuries is overuse of the wrists and hands at the computer. Our bodies flourish when there is frequent variety in our movement. And our bodies don't like stationary work with limited movement, like sitting at a computer for 8 or 10 hours a day and holding our arms in the same position while our fingers type. This repetitive stress causes a cumulative fatigue that leads to serious injury in the wrist ligaments. 4. The assessment of the injury. In order to effectively treat a wrist injury, you first have to assess what's wrong. There are 4 simple tests. First, you test the wrist with passive flexion and passive extension. If there's pain and or limitation of movement, it means there's inflammation and swelling inside the joint. Next, you test radial deviation of the wrist. This is it. And if there's discomfort on the ulnar side of the wrist, it means that the ulnar collateral ligament is sprained. And finally, you test ulnar deviation of the wrist. And if there's discomfort or pain on the radial side of the wrist, it means that the radial collateral ligament is sprained. 5. Treatment of the injury. I recommend 2 types of treatment to help resolve wrist pain. The first is hands-on treatment to eliminate the adhesive scar tissue. After uncovering which ligaments are injured during the assessment tests, friction therapy breaks apart the pain-producing scar tissue. Once the ligaments are successfully treated, the swelling and pain slowly diminish and full function returns. But friction therapy can't help it when there's scar tissue that's too entrenched or in an area not easily accessible to the hands. In those situations, I refer my clients to receive skillful injection therapy, often combined with manipulation, and that will usually resolve the issue. 6. Prevention of future injuries. Several things will prevent a relapse once someone recovers from a wrist injury. Consistent exercise is vital to maintaining a healthy body. So make sure your clients are doing regular strength and stretching exercises for the fingers, wrists, forearms, and shoulders. Aerobic activity, at least 90 minutes a week, is also essential for health. In addition to exercise, suggest using free break reminder software such as BreakTime or ZenBreak for Windows or Lookaway for Macs. They will prompt the client to take a break every 30 or 45 minutes. Everyone who gets carried away at the computer and doesn't take frequent breaks should use it. To summarize, chronic pain in the wrist means something is injured. likely a ligament. The first step is to assess the wrist so you know exactly where it's gone wrong. Second, apply the treatment that fits. Third, figure out what's weak and put in place an exercise program that maximizes strength and flexibility for the wrist, hand, and forearm. If wrist pain is part of your practice, whether it's your own wrist or your client's, I hope this video helped you better understand what's going on and how to move forward. Inside my Anatomy in Action subscription, we have an entire training module dedicated to wrist injuries with hands-on techniques and clinical reasoning you can use right away. If you're ready to deepen your skills, check it out using the link in the description below. Next week, I'm sharing a story about a client who lived with wrist and forearm pain for 8 years and how I was finally able to help her heal with an integrated treatment plan. Hit the subscribe button so you don't miss it. See you next time.